More politically charged topics that is happening in our nation regarding gender affirming care. Just last month, the nation's largest political organization for plastic surgeons now recommending that gender affirming surgeries be delayed until a patient turns 19. We're talking about the American Society of Plastic Surgeons, and it is a change in the group's stance on this topic. To talk about this today and the impact that it could have on people in our country, we have Dr. Kristopher Day, who is an award-winning double board certified plastic and reconstructive surgeon. He joins us this morning. Thank you so much for taking time out to talk about this very important topic.
Oh, no problem. Thanks for having me.
So first, let's start with the decision now to kind of change the recommendation by this particular organization. For those who may not understand the significance that it could hold, what does that mean in terms of the guidance for people like yourself who are in your profession?
Right. That was something that I had to figure out for myself in these last few weeks. We're based in Seattle. There's a lot of patients who seek out gender affirming surgery here. It's actually a care that I didn't seek out to do, but patients sought us out after I treated some patients. And then Seattle Children's, a very famous children's hospital, actually elected with the executive order to refrain from doing these surgeries. So we were getting more young patients. And so that's how it kind of found us. What was put out by the American Society of Plastic Surgery is what's called a position statement. And basically, as a board certified plastic surgeon and proud member of the American Society of Plastic Surgery, I try to align and I use, this is an organization that's also educational, provides direction and guidance as well as leadership. I participate in it in a number of committees. So I try to align with what my national society says is good care in a general sense. And so I think first and foremost, that's what a position statement does for its members. And then additionally, I think just like is happening here today, where we're talking on a news publication and there's print versions of this and others, insurance companies, elected leaders, and news agencies sort of take these as signs of what they are, the position of the organization, and use that for maybe influence on other decisions such as laws and policies and whether or not people get coverage. I would imagine that is how this would be utilized afterwards.
And we know that the current administration has been very outspoken when it comes to being against gender affirming care, particularly amongst young people within our nation. One thing I wanted to bring up based upon that, though, this may be the largest group, but it's not the only group of this particular, professionals when it comes to plastic surgeons. And there are other medical groups that are still standing by their guidance, saying that there are already some things in place to make sure, particularly when it comes to minors, that they are considered in terms of the best use of care. I wanted to ask you, based upon your experience, you said something that this wasn't something you sought out, but it's something that you now have been doing. For people who have never talked to anyone or been in this, kind of position themselves, what are those conversations like between either the patients, maybe their parents, and what are the steps that then take place after someone approaches you when it comes to this type of care? As best that you can speak to us, obviously, I'm sure you wouldn't give us specifics, but what are those conversations like when they start in the process after that?
Yeah, so kind of two questions, like how did we come into it, and then what are those processes like as a provider? I came into it basically because I went to work in a university where somebody retired who was doing this care, and then they said, "Hey, Chris, you're going to do this now," and I said, "Okay," and then sort of had to figure that out along the way. The experience, though, in going through that is basically learning, education. I've taken sensitivity courses. I've done, a number of coursework. I've applied the things that I have a lot of experience with that are transferable skill sets. And that's really what gender affirming surgical care has evolved from. I mean, as plastic surgeons, we're a fairly innovative field. We are a principle based surgery, and so those principles can be applied, and we are often the basis for many surgical innovations. It's one of the things I'm proud of, being a plastic surgeon. Um, in terms of the actual experience, especially with minors, so we probably did about half a dozen under the age of 18 surgeries. And again, they sought us out. We did not go seek out this care. And I would say 100% were very satisfied with their care. They're very happy. We had one child who felt that their anxiety was so overwhelming they could not attend school, which they and their parents were very pleased about after receiving surgery. Another child that was actually suicidal was practicing cutting or self-harm behaviors and stopped doing that after their surgery because their gender dysphoria had improved. I'm a father of three from a town of six stoplights in fairly conservative Midwest. I cannot say that this is something that personally resonates with myself as a, cisgendered heterosexual individual, but I can say that it does appeal to what I think being a good doctor and physician is, which is being what your patients need you to be in the delivery of the things that you can offer them medically. So that's really the center of the principles that we've tried to exercise as we make decisions for our own personal delivery of this care.
You kind of mentioned in there some of the reasons behind when you are approached by either patients, their families. Um, I think, anxiety and dysmorphia. What are some of the reasons that people would maybe come to you and say, hey, this is why, I really am requesting X, Y, and Z. I believe it would benefit me. What are some of the other things that you're kind of hearing? I'm just trying to paint the picture for maybe people, again, as you said, this is not their experience. This isn't something that maybe they've had conversations with others, and why people come to you for this particular type of care.
And Eugene, that's a great question because I think that's one of the questions that is not asked often enough. We see this as how does it relate to me, and we're changing people's bodies, and do I agree with that? Would I do that to myself? I don't know that that's the question that the public should necessarily be asking, but that question of why patients are seeking out this in the first place is probably a more interesting question and probably a more fruitful question in terms of understanding. So, the basis is really gender dysphoria. I'm not a specialist in gender dysphoria. We practice this in a multidisciplinary practice. So, basically, what that means is a licensed mental health professional, clinical psychologist, psychiatrist, or also the primary care physician, according to WPATH, which is the organization that defines these standards, has to diagnose gender dysphoria. Gender dysphoria is fundamentally a patient feeling like they are not in the body of their gender identity. So that would be a biologic male feeling like they are a female, or a biologic female feeling like they are a male. Quite honestly, I'm not someone who can really deeply explain that, but I rely on my mental health professional colleagues to treat, analyze, and often these are months and months of evaluations before someone is concluding that this person has gender dysphoria. Once someone's been diagnosed with gender dysphoria and they're seeking out a surgical remedy of that dysphoria, then that's when they would seek out a surgical consultation.
I heard you mention WPAT. I assume you're talking about the World Professional Association for Transgender Health. Is that correct?
Right.
Okay.
So, so
And
in
go ahead.
Oh, sorry. So basically, in light of the fact that this is controversial, the sort of I guess you would say world scholarly community has said, okay, well, we need to look at this not only from a like one town or one state or one city or even one country, but let's look at this in terms of overall. So there's international conglomeration of multidisciplinary experts that have sat on multiple panels, multiple committees spent, hundreds of man hours to come up with standards that basically are the guide, usually used by insurance companies and especially used by providers like myself who want to be following the standard of care. So we've always followed the WPATH guidelines for this surgical care.
And I'm glad you mentioned that as well, because I think it's important to note in this that after we heard from the American Society of Plastic Surgeons, the WPATH, which is what you're mentioning here, they doubled down and reiterated its support for access to surgical care for minors, saying that they already have cautious guidelines and criteria. The American Society of Plastic Surgeons saying that they'd found insufficient evidence that the benefit of the surgeries for minors who experience gender dysphoria outweighs the risk. Getting back into that, assuming that there are, doctor surgeons who within, regions that are looking at this and saying, you know what, I'm going to follow the American Society of Plastic Surgeons and what they put out for their statement that they put out. For you and your community, assuming that, what does that mean? How does that impact care? How does that impact options for people who are possibly seeking this particular care in your community?
Yeah, it's a great question. There has been some direct impact. I mean, immediately we receive these emails about position statements, or we hear about them through the news, like just like anyone else. And immediately we ceased offering this care again because I do believe in, and I am a card-carrying member of the American Society of Plastic Surgery. That is an organization that I believe in. So I wanted to align with that. Quite honestly, too, if a large national organization puts out a position statement and then you go against that and anything bad happens, you're in a very precarious position, I believe, medical legally. So that is not something that I was comfortable with. The direct impact of this in our community. So, in one of the largest, most liberal, and fastest growing cities in the country, there, according to one, I don't have comprehensive knowledge of this, but according to one referring clinic coordinator, it ceased minor gender affirming care in and around Seattle.
We were talking about the discourse and the conversation. This has become such a big and important conversation for a lot of people across our country, just in terms of the dialogue and the temperament around the dialogue. You are kind of caught within all of this, right? In what you offer and what you do. What are some of the things you just wish people who are learning about it, who have their thoughts about this, that they would remember when we're having these conversations that ultimately could potentially impact policy and the care for individuals?
Um, well, I don't know if I have a complete understanding of that. I have participated in now a few conversations with groups that are kind of, I should point out, I would be remiss if not to point out that there's a heterogeneous mindset within any group, including our society. And there's certainly multiple members who don't agree with the position statement. There are certainly multiple members who strongly believe in the position statement. And then there are those, and their recent communication is really about looking into this further and gathering more information and further analyzing. So I think that's always healthy if you're relying on science and research and conversations amongst experienced professionals. So that's good. And I think that's the temperature of the conversation as I understand it now, at least within our community. I think in the lay public, there's very polarizing positions, right? There's going to be people who feel very strongly for, very strongly against. Again, I think we just try to be helpful to our patients in the delivery of our skill sets for their betterment, often as defined by those patients. It's not only defined by those patients, but often as defined by those patients. And so, yeah, at the end of the day, I think I feel good about what we offer to people, what we have done for people, and in their own feedback, it's been positive for them.
Dr. Kristopher Day coming to us all the way from Washington. We're so thankful for you. I think I'd be amiss to say that, when we're talking about the conversation around this, it is a political thing, but also a legal thing at this point now. We know that the Trump administration moved at the end of last year to cut gender affirming care for minors, and that prompted a third of the U.S. at this point states to sue. So there are multiple states that are now caught in this legal battle with the administration all around the conversation that we're having here. So important to note what this particular professional society is now saying, and also to hear from doctors such as yourself about what you're seeing day to day in your profession. Anything else you'd like to leave with our viewers about this particular topic, Dr. Day?
I don't know that I'm the source of a great wisdom, but I gave a presentation a couple weeks ago at a scientific conference, and one of my topics was in gender affirmation surgery, and I deferred myself to greater wisdom, which was William Osler, who's kind of, some people would say, like the world's greatest ever doctor. Um, and he said to keep a looking glass on in your own heart, in delivery of healthcare. And I will tell you that it's a long journey and a marathon, and sometimes that's difficult to do. Sometimes we find ourselves in corporate structures or institutions that seem so much greater than ourselves. But I think each individual brings something to the table, and I think we're treating also a spectrum of people across the country that are all different and diverse. So, keeping a looking glass and reflecting and analyzing the impact that you have on people, I think it's healthy for everybody, whether you're a physician or a patient or somebody looking at this from the outside. So that's what I try to do.
I think wise words there, Dr. Day. And we appreciate you again for taking the time this morning and talking to us about a very important topic. Again, a controversial one, but a very important conversation indeed. Thank you so much, Dr. Day. We appreciate you.